my next guest, I feel like she's my BFF. She's on so much. Her name is Samantha Olds Frye, and Samantha is doing God's work. She's with the IAMHP, which she's going to tell me again what that's an acronym for. Hi, Samantha. How are you?
I'm great, Carrie, and so excited to be your BFF, for sure.
So, Samantha, what is the IAMHP again? I'm sorry.
Oh, no, don't apologize. So we are the Illinois Association of Medicaid Health Plans. So we represent the Medicaid health plans that are serving over 2 million people across the state of Illinois. So that is sort of our perspective and who we are.
All right, then. Well, let's start with the update on the vaccine. I said earlier that we're going to do some myth busting. And Monday, we had a wonderful conversation on the vaccine, and people were talking about it if they're, kind of reticent to take it. I mean, and we've talked about it before, but for some reason, Monday was a really interesting conversation. And let me just say this, Samantha. I don't know if you've seen the images that are coming out of Delhi, India. And they've got all of these hundreds of pyres burning at the same time, which are cremations there. That's how they cremate the dead there. And we're talking 600 deaths a day. Don't you think that those people wish they had the same kind of access to the vaccine that we have here?
Absolutely. And that's really one of the challenges and exactly the types of situations we are trying to avoid. And we are so fortunate to have now readily available access to vaccines to ensure, we don't find ourselves in that situation. And then also as a country and the world trying to really, step up and help India as, just truly terrifying.
It is terrifying. I mean, it's terrifying. Yeah. And, again, we're very lucky, too, because we are in the United States. We do have a pretty sound infrastructure. We're able to wash our hands. We're getting the information about the vaccine and testing. And I'm telling you, places like Brazil and India, it makes me very glad that I am here in the U.S. because their public policy on the coronavirus is what is driving the deaths tolls in those two places. So let's first of all, I'm going to get to your call, Jasmine, in just a minute. Because we'll find out a little bit more about you. But Samantha, right now, what's the updates in Illinois and in terms of the vaccine?
Yeah, so big updates. Everybody 16 and older is eligible to get vaccinated across the state, in Chicago, in Cook County, and elsewhere in the state, 16 and over. If you are 16 to 18, of course, you need that Pfizer vaccine. So do look for locations with Pfizer. The city of Chicago and Cook County have now opened up their mass vaccination sites to walk up. You don't need an appointment, but you could get one.
Right.
The Medicaid health plans, if you're enrolled in Medicaid, they can help schedule an appointment for you if you'd like, and they will cover transportation to and from the vaccine site. You don't have to worry about an Uber or taking the train or anything. The health plan will pay for that. They'll coordinate it. And then the fourth piece that I want to make sure people know is that if you're homebound or you have a family member who's homebound, you can't go out to the mass vaccination sites, go ahead and call, and you're on Medicaid, go ahead and call your health plan. Mm-hmm. They're actually working with the fire department to have vaccinations in your home. So they'll come to you to make sure you get that protection. And then, of course, the new news out of the CDC, if you're fully vaccinated, you can be outside without a mask. And let me tell you something. I took my mask off yesterday, and it felt so good to have, a sigh of relief to not have to have my mask on outside as long as I'm not in a crowded space.
I just can't believe this kind of services are provided. Can you, Titus? I just can't believe it. So if you're on Medicaid and you're living on the South Side and you want to go to the United Center, you don't have to get on 2 buses, 4 trains, and an Uber to get there. I just think this is fantastic.
Yes, we want to make it as easy as possible because, we need people to get vaccinated so that we can, get back to our regular life. Like, this is really the ticket to get back to normal. So we are, as the Medicaid health plans, doing our part to make sure we get there.
All right, then I want to go to Jasmine's call because Jasmine wants to know why she should get the vax. Hi, Jasmine. How are you?
Yes, I'm good, and I'm not a vaccinated person. I really don't know that I'm going to get vaccinated, especially since I read an article this morning that said 600 fully vaccinated people in Illinois got the coronavirus. So what is the vaccination doing?
First of all, I want to know what was the source of the story you wrote. Do you remember?
I don't remember. I saw it on the internet.
Okay, if it's on the internet, it doesn't make it necessarily true. We all know that.
Okay.
But always, let me just say this to you, Jasmine. Always, when you are researching things and you're on the internet, look at the source first. If it's something that doesn't look, or if it's a website that doesn't give any any accreditation to a reputable news site or news organization, it's probably not true. But you just do it. But you want to ask.
That's good information.
Okay.
So I just want to know if it's not. Does the vaccine keep me from getting the coronavirus? Why should I get this vaccine?
Okay, go ahead, Samantha. You can answer that.
Perfect. So what the vaccine does, and this is all three, there are a couple components they do. So first of all, we want to protect against you getting the vaccine or getting the virus. So that's what they do very effectively. However, there are two other pieces that we want to make sure that happens if you get it or you're exposed to it, that you get a mild case, that you don't end up hospitalized, and most importantly, you don't die. And that's what the vaccine does as well. And so fully vaccinated folks, it's not 100%. You may have a breakthrough case. We have seen a few of those, very, very, very rare. These vaccines are far more effective than anything like the flu vaccine that we get annually. But what we have seen is a very high percentage of people who are vaccinated, and a lots of studies on this, that should you get a case, you're far less likely to end up with an extreme case, end up hospitalized, and most importantly, 100% effective against death. And that, at the end of the day, is what we're really trying to prevent. Of course, nobody wants a cold, nobody wants the sniffles, nobody wants, a fever or body ache. But what we really don't want is what we see happening in India, where tons and thousands of people are dying or are in
tens of thousands of people, tens of thousands.
Tens and thousands. Right. Thank you, Perry. Yeah. So that's the end goal. That is what we really want to prevent. And these vaccines are effective at that, very, very effective at that, and actually far more effective than we originally anticipated at preventing even, an asymptomatic or minor symptom cases. So there are a few breakthrough cases. We have seen them. They're incredibly rare. Oftentimes we're seeing them more with people who aren't fully vaccinated, so you got your one vaccine, but you haven't gotten your follow-up. But again, even in those cases, incredibly, incredibly rare.
So when it says like one of them, Pfizer or Moderna or something, is like 90%, that means you have a 90% chance of not getting the coronavirus?
Yes, that is exactly what that means.
Okay.
All right. Thank you, Jasmine. Jasmine, I appreciate your call. Samantha Olds-Frey is our guest, and she is an expert with Medicaid. And these weeks that she's been on with us, I have learned so much about Medicaid, and I just think what they do and what Illinois has done with their Medicaid is nothing less than remarkable. the Medicaid. If you have Medicaid, Samantha revealed to us that somebody will come pick you up and take you to get your vaccine and bring you back home, no matter what side of town you live on or where you want to go. I think this is absolutely amazing, and not only that, for those that are homebound or cannot get out to deal with this vaccine and being around people, there are people that will come to you with the fire department. Samantha, again, this is just nothing less than remarkable. Let's go to Louise's call. Hi, Louise. How are you today?
Hi, Perry. I'm fine. And you?
I'm good.
Good. I'd like to know, if you've already been vaccinated, are you still suggesting wearing of a mask?
Yes, so the CDC is recommending that if you are in a crowded area, if you're, at a grocery store, if you're at a baseball game, or if you're in a crowded space or you're traveling, that you wear a mask. However, if you're in your home and you invite somebody over that's either fully vaccinated or just one family, one group of people, you don't need to wear a mask. You can have that that dinner party that we've missed so sorely for so many months. And then also just this week they announced that if you're outside and you're walking or you're biking or you're not in a crowded area, you also do not need a mask outside if you are fully vaccinated. But if you're in a crowded area, they do still recommend masks at this time, but they're studying it to see when that guidance can be updated.
Louise, do you know that I have decided, now I'm 61 years old, Louise, I will probably wear a mask for the rest of my life.
Okay.
I'm wearing a mask. Do you know I did not have one cold or the flu this winter?
Okay.
All right, then wear your mask.
Do you suggest that you need a flu shot to go with the COVID shot?
Oh, no, I'm not suggesting that. No. What I was suggesting that because we wear our mask, that's probably why so many of us did not get the flu this year.
Okay.
Yeah.
All right. Well, thank you.
Thank you, Louise. Let's go to Michael. Hi, Michael.
Hi, Perry. Matter of fact, that was part of my question. I listen to your show every day, but I always listen when this young lady comes on. Samantha, is it?
Yes.
Yeah, she's very informative, and, thank you guys for having her.
Oh, that's a nice compliment, Samantha.
Yeah.
I'm feeling really good. Thank you.
Very informative. I'm 68. I've had both my shots. Do I still need to get a flu shot?
Great question. So when flu season comes up, we're right at the tail end of it, but for next year, you will still need a flu shot. It's a separate virus that causes the flu, the influenza virus. So the COVID vaccine does not protect against that. So it is still recommended that you get your flu shot.
Thank you. Also, I know the young lady on before, she said something about she wasn't going to take the vaccination. Will Medicare benefits be interrupted if you don't get a COVID shot? COVID vaccination shot?
That's a great question. No. Your coverage will continue, both Medicare or Medicaid. There's no requirement. It's just strongly recommended that you get the vaccine so that you can, prevent illness in yourself and in others.
Good answer. Thank you so much.
All right. Thank you, Michael. I appreciate it. You're a young-sounding 68 years old, I'll tell you that. Well, Samantha, you have done your job. What do you want to leave our audience with today before you take off?
Really, just a reminder that the COVID vaccine is free to every Illinoisan. If you are on Medicaid, as a reminder, we will cover transportation to and from your vaccination site, and your health plan can even arrange your appointment for them. So you just have to call your member services line, and they will help coordinate that for you. And really, if you have any questions, it's normal to have questions about this vaccine. It's new. Go ahead and reach out to your doctor. That's going to be the best source of information based off of your unique health situation. Talk to your doctor to have them answer your questions far better than an internet search. But if you're going to go to a website, definitely check out the CDC and the Illinois Department of Public Health. And then finally, feel free to follow us on Facebook, LinkedIn, and Twitter at IamHip, IAMHP, or check out our website at imhip.net. And as always, Carrie, thank you so much. Your listeners and your show is just absolutely amazing.
Oh, thank you so much, Samantha. It really is nice to have you on. I just really enjoy you.